What are the different ways that we can treat hair thinning that doesn't involve a transplant or injections? Welcome back to the channel. It's Dr. Durst. I am a regenerative medicine specialist that does have a focus in sexual wellness. Today's topic is not sexual wellness, though. It is hair thinning and some advanced laser treatments for that. So, hair thinning is super common in both men and women. And at the age of 50, about 40% of women and about 50% of men will have hair thinning. It increases in incidence with age. And so, what can we do about it? Well, let's look at what might be causing it. So, the most common cause of that is androgenic hair loss. And so, that's usually related to androgens causing some thinning. Obviously, that can be more severe in men, but again, even 40% of women as they get older will get thinning. So, for men, they get that receding hairline and then the crown of the head so that they get some balding up here. For women, it tends to be a more concentrated central and just overall thinning. And so we want to improve the thickness of the hair, the number of hair follicles, and get that hair health back. And so, some things that you can do early on in hair thinning, because it's so common, it affects our confidence. We want to be able to treat it at the first signs of noticing it. So, and it's a difficult thing to regrow hair, so you want to hit it in multiple ways. Nutrafol is a supplement that basically gives you all the nutrients that are necessary for hair follicle to be healthy. And then we can do injectables, but today I wanted to talk a little bit about Carelase. There's some laser light therapies and caps that you'll hear that can be used for hair thinning, but then there's also a laser treatment that can be used that allows us to apply a topical peptide after that helps with hair growth. So Carelase is the name of the treatment, but laser treatments, they've been around since the 60s. They changed the hair laser treatment that I'm about to mention is a relatively new application of laser therapies. But basically, with this one, it's a fractional non-ablative. So you're not ablating anything off the top. You're just using the lasers to create microchannels in the scalp around the hair follicle. And by doing that, we're telling the hair follicle in the scalp that it's injured and to repair. So you're already getting that messaging signaling going on. So that's one of the keys to that. But then we can apply a topical that has some peptides and some growth factors in it that can then stimulate the hair follicle. Our goal is to get the hair follicle out of the resting phase and into the active phase. And that can be a little more difficult with hair because it's slow growing. We want to hit the hair follicle when it's close to the active phase or when it's in the active phase to prolong that. So I do recommend this treatment. It is super comfortable. We use the laser at a low energy level to create those microchannels. We apply that topical growth factor and peptide serum that you go home with, and it seeps into those microchannels to stimulate that hair follicle into the active phase or a prolonged active phase so that you get increased thickening of the hair follicle because over time we get this miniaturization of it. So our hair follicle gets smaller, or sometimes we used to have a couple hair follicles coming out of the hair tubicle, but then now all of a sudden we might just have one. So we want to increase the number, we want to increase the thickness and the health. And we can do that with this laser treatment. It's technically called KeraLase. KeraFactor is the topical that we apply on it. And then we can give you that to go home with as well to continue to apply. Some other things that can be causing it is other hormonal changes. So again, if you have a concentration of DHT, testosterone converts to DHT in the body. Sometimes you don't even have to be on testosterone. You don't have to have too much of DHT, but it could concentrate in the hair follicle and cause some of that thinning. You can have side effects of some hormone replacement that can easily be avoided. And so just make sure that they're checking the DHT and potentially using something that or preventing that DHT conversion. Thyroid problems can cause issues, stress can cause issues, certain medical problems and medicines can cause some hair thinning. So that's something that you want to have comprehensively looked at so that you can address everything and again apply or at least take those nutrients that are necessary for the hair follicle health. But the things that you can think about is this is a painless way to stimulate that hair follicle health, and you can do it every 2 weeks in the office. I always recommend a series of at least 6, but it's a painless way to get on top of hair thinning as soon as you see it. So, hopefully, this is helpful. And please let me know if you have some questions about it or if you have some treatments that you have tried that you would like to share. Let's start that conversation in the comments below. And let me know if there's anything else you want to talk about because I am willing to deep dive into anything wellness or sexual wellness. Thank you.